Welcome to our discussion on wound classification in forensic medicine. This subject is integral to criminal investigations, helping us understanding the cause and nature of injuries. What is the wound? The wound is defined in forensic pathology as damage to any part of the body due to the application of mechanical force. The intensity of the force obeys the usual laws of physics, in that the force varies directly with the mass of the weapon and directly with the square of velocity of impact. Of course, the weapon can be anything, including the body itself, as is often seen in a fall or a traffic accident. Today, we will explore the different types of wounds and their significance in forensic medicine. Each wound tells a story, providing crucial information that can help solve criminal investigations. Forensic medicine wounds are classified according to the tool that caused this wound or injury. First, an injury caused by a blunt object is subdivided into a bruise or contusion, abrasion, laceration, fracture and dislocation of teeth or bone. Second, an injury caused by sharp-edged weapon is subdivided into incised wound and stab wound. Third, a wound that is caused by heat or cold, called thermal wound. Fourth, firearm wound, that is caused by firearm tool. There are other types of wounds, such as those caused by chemical substances or electrocution. Medico-legal classification of wounds or injuries. Injuries classified from legal-wise according to most probable mode of the injury and could be divided into suicidal injuries, homicidal injuries, accidental injuries, defense wounds, or fabricated wounds, or the so-called self-inflicted wounds. In this lecture, we will give some details about blunt force injuries. These injuries are often the result of an object coming into contact with the body with a certain level of force. The blunt object doesn't have sharp edges and doesn't penetrate the skin, but the impact can still cause significant damage. Blunt force injuries can be categorized into subtypes: contusions, abrasions, lacerations, and fractures. Please stay with me to learn further about this subject and its importance in forensic medicine. A bruise is a type of injury caused by blunt objects such as the hands, feet, table and wall, etc. It is a localized collection of blood outside the blood vessels, caused by the rupture of blood vessels beneath the skin. It's a common injury that can occur in everyday life. But in the world of forensic medicine, it can be a crucial piece of evidence. Forensic doctors can determine a lot from a bruise, such as the force of the impact, the shape of the object that caused it, and sometimes the time frame for the injury. This information can help reconstruct a crime scene or confirm a victim's account of events. The bruise changes color over time. A forensic pathologist sometimes can tell approximately how old the bruise is, but not in all cases. And many times the doctor can't tell. Fresh bruises are usually red, then turn blue or purple within a few hours, and finally yellow or green after a few days. Unfortunately, aging a bruise is not an exact science and can vary from person to person. Factors such as the victim's age, health, and the location of the bruise can affect how quickly it heals and affects the color changes. This can make it difficult to establish a precise timeline. So next time you watch a movie about CSI and hear the doctor or the forensic scientist telling the exact age of a bruise, know that this is not completely true. We've all had our fair share of scrapes and scratches. But what exactly is an abrasion? It's a superficial damage to your skin, usually caused by a rough surface scraping against it, causing damage to the outer layer of the skin. In the world of forensics, abrasions can tell a story. An abrasion's size, shape, and location can provide critical information about what happened during a crime. For instance, the presence of abrasions on the knuckles might suggest that a fight took place. Forensic experts can also determine the direction of a force from the pattern of an abrasion. The direction can help piece together the sequence of events, giving investigators a clearer picture of the crime scene. Furthermore, the age of abrasions can be estimated by forensic pathologists. This can help establish a timeline for when the injury occurred, which is crucial in criminal investigations. Notice that hanging ligature mark, as shown in the photo, is considered abrasion. Laceration wounds. It's important to understand what a laceration wound is. Unlike a clean cut from a sharp object, a laceration is a tear in the skin caused by blunt trauma. The edges of these wounds are often irregular and jagged. The base of the laceration wound is crushed. The boundaries of the wound are bruised or abraded. The shape of the wound is irregular. One of the key aspects of laceration wounds is their size and shape. This can give the forensic doctor a clue about the object or force that caused the wound, as well as the direction of the blow. By studying these wounds, pathologists can piece together the events leading up to an injury or death, providing valuable evidence in criminal investigations. Blunt trauma injuries also may appear on the victim as defense wounds. The definition of defense wounds is injuries that occur when people try to protect themselves during an attack. The person may ward off the weapon or try to catch or grab the weapon, so the victim injures the upper limb while trying to protect his or her face and neck. Similarly, the anterior and posterior aspects of the lower limbs and back may be injured when an individual tries to protect the anterior part of the body, like the abdomen or the genitalias. Defense wounds are a significant piece of evidence in violent crimes. They not only reveal the struggle of the victim, but also provide key information about the attacker and the weapon used. By studying these wounds, forensic experts can piece together the story of what happened, aiding in the pursuit of justice. We will talk more widely about defense wounds when discussing sharp injuries. Congratulations! You made it! You finished the first part of wounds classification in forensic medicine. In the upcoming lectures, we will talk about the other types of wounds. Can a stab wound be suicidal? We will know more soon. In conclusion, blunt force injuries play a vital role in forensic medicine. Through careful analysis of these injuries, forensic doctors can clarify by their reports the truth behind a variety of incidents. These injuries are often seen in cases of assault, motor vehicle accidents, and falls, and are characterized mainly by a lack of sharp edges. In the coming lectures, we will talk thoroughly about the other types of wounds, their medico-legal importance, and the role of forensic physicians in clarifying them to the court. See you soon.